Brought to you by Agilus Diagnostics.
Agilus Diagnostics.
Hello, welcome to Fit KHABAR. I'm Roshnita. Let's take a look at the weekly roundup of news from the world of health. The Indian government has banned 156 combination drugs, including popular medications like paracetamol and cetirizine, as a part of an effort to enhance public health safety. This move follows concerns over the quality of these drugs, which are widely used across the country. In addition to the ban, 34 multivitamins are under review for potential action. Overall, 52 drug samples failed quality tests, raising serious concerns about the safety of commonly used medicines. The Drugs Controller General of India has given final approval to Entod Pharmaceuticals Press UI drops, designed to reduce the need for reading glasses in people with presbyopia. This age-related condition affects those over 40, causing difficulty in focusing on close objects as the eye's focusing ability weakens. The approval comes after a recommendation by the Subject Expert Committee of the Central Drug Standard Control Organization. Presbyopia is often first noticed when individuals start holding reading materials at arm's length, and a simple eye exam can confirm the diagnosis. A recent WHO commissioned study has found no link between mobile phone use and brain or head cancers, even with prolonged use. Researchers reviewed over 5,000 studies and found no increased risk of cancers like glioma and salivary gland tumors among mobile phones users. The study, led by the Australian Radiation Protection and Nuclear Safety Agency, concluded that despite the sharp rise in mobile phone use, brain tumor rates have remained stable. This review counters previous concerns about radiofrequency electromagnetic radiation, which the WHO's International Agency for Research on Cancer had classified as a possible carcinogen in 2011. The analysis also debunked earlier associations seen in case control studies, clarifying there is no increased cancer risk with long-term or frequent mobile phone use. Karnataka has declared an epidemic due to a dramatic rise in dengue cases, with 25,000 reported this year and 12 deaths. The surge, including 15,000 cases in just 45 days, has led to the implementation of stricter regulations under the Karnataka Epidemic Diseases Regulations 2020. The regulations mandate that residents eliminate stagnant water to prevent mosquito breeding. The government must enhance its efforts to control dengue and other vector-borne diseases to protect public health and prevent further escalation. Since March 2024, India has not reported any new cases of Mpox, formerly known as monkeypox, and the risk for the country has been assessed as low by the National Centre for Disease Control. The WHO had earlier declared Mpox a public health emergency of international concern. Despite the low risk in India, both the national and state governments have implemented precautionary measures to ensure early detection, testing, isolation, and management of any travel-related cases. The WHO latest report, dated September 3, shows a global total of 1,02,997 confirmed Mpox cases and 223 deaths since January 1, 2022. Notably, Clade 1A and Clade 2 are spreading more rapidly in several African nations. Scientists at the Institute of Nanoscience and Technology in Mohali have developed a heat-based approach to cancer treatment that could reduce chemotherapy doses. By combining an inhibitor of heat shock protein 90 with magnetic hyperthermia-based cancer therapy, the technique enhances the effectiveness of heat-based cancer treatments while minimizing chemotherapy side effects. In a rat glioma model, the therapy achieved up to 65% tumor inhibition at primary sites and 53% at secondary sites. The method is less invasive and more targeted, using magnetic nanoparticles to combat tumors without additional doses for secondary tumors. And an MC task force has recommended that resident doctors work no more than 74 hours a week and receive a weekly day off to protect their mental and physical health. It emphasized that sleep and rest are crucial for medical students, urging hospitals to provide comfortable rest areas and nutritious meals. The report also called for medical institutions to follow anti-ragging regulations strictly, with active anti-ragging cells in place. A gatekeeper training program was suggested to identify and support students at risk of mental health issues. That's all for today. Keep watching Fit KHABAR on Fit Tak.